Hi, this is Dr. Michael Brisman, neurosurgeon from Long Island, sharing with you some interesting cases of mine. So, this patient is a 61-year-old woman who was being treated for non-small cell lung cancer, the most common type of lung cancer, and was found to have 3 brain metastases. She didn't have any symptoms, but it was part of her evaluation. And for most people with brain metastases, we are treating them with gamma knife, 1 day outpatient radiosurgery treatment. If they have many, many tumors, 20, 30, then I think whole brain radiation remains the way to go. And if there's one large tumor with lots and lots of mass effect that comes to the surface, I think removing it makes sense. But for most patients, we're treating them with 1 day outpatient gamma knife treatment. And if there are recurrences or other tumors that develop over time, they get a repeat treatment. So this is just an example of such a treatment. So this patient, these are 2 of the tumors, and the yellow is the 50% isosceles line, the green is the 40% isosceles line. This is a left parietal, left frontal tumor. Here are two of her 3 tumors. This image shows the 3rd tumor, which was next to one of the other tumors. Treatment was uneventful. She did very well. And I'll just show you, this is her MRI 6 years later, showing the tumors are all gone. Obviously the tumors shrank sooner than this, but I just want to show you how we had a very robust response, good response. And, one of the biggest issues with these people, how they do is the ability to control systemic disease. And her systemic disease, her disease outside the brain was well controlled, but we're actually, better and better able to control the disease in the brain. So this was one image of MRI. This is another image, again, 6 years later, showing the tumors were still gone. Even 6 years later, she did very well. And again, I think this is a very, for me, the treatment of choice for people with brain metastases, better than I think the surgery or the whole brain radiation, which can take several weeks, can cause memory loss and hair loss and other things. So I think this is the way to go and a very nice option, and people are happy with it. So thank you for hearing about this interesting case.